Brought to you by Skinsational, Dr.
To
Luciano.
understand what breast augmentation is, which is a type of plastic surgery, we have Dr. Luciano here this morning to break this all down for us. You're our local cosmetic surgeon. Thanks for coming in again.
Thank you. Good morning.
Can you tell us what breast augmentation is? I know it's another word for the common phrase.
Breast augmentation is the increase in the amount of breast volume. It's the ideal person for a cosmetic breast augmentation is someone that has lost weight and volume, or due to pregnancy and the breasts have lost the volume, or they just perceive their breasts as being small and they want to have it augmented.
So as far as the implants go, I find this very interesting. What is the material that these implants are made of, and are there multiple kinds?
Currently we have two types. We have a silicone implant. They are all made of silicone, by the way. They are filled with a silicone gel or with saline. There are cosmetic differences. Everybody has their own anatomy and individual needs, but there's a certain difference there, and there's a difference in cost as well.
And you said individual needs, so we can find out those details, which would be best for us in a consultation?
That's correct. The case? Yeah, that's correct. Then you discuss your anatomy, realistic expectations, what breast surgery entails. Unlike a liposuction and tummy tuck that you come in for a one-time procedure, when you want to do a breast augmentation with implants, you're opening the door to multiple surgeries.
Really?
The FDA recommends the implant be exchanged or removed every 10 years.
Okay.
You may need revisions in between. For most people, it's a significant undertake financially.
Sure.
So you have to be mindful of that and see if you really want to get into that road.
I'm picturing the implant, but I can't picture, how do you do it?
You do it by placing the implant in the breast, whether it's saline or silicone. You put it through the armpit, through the areola, or through the fold. We prefer the armpit because it gives you a better cosmetic result with no visible scars.
Can you tell me a little bit more about the downtime? Because I'm sure the recovery can be a little brutal.
The downtime, exercise 1 month or less. We always under promise, so sometimes you can exercise in 3 or 2 weeks. Depends where the implant is placed. Driving maybe 5 to 10 days. Office work 10 to 14 days. It all depends on the person.
Let's see some before and afters,
Sure.
especially how you say that you can do it without scarring.
Well, here you have the implant placed through the axilla. You don't see, but there's no scars in the breast fold, in the areola, because it's blurred. But that's a small implant, was maybe 350 cc's of normal saline. She did not want a large implant. This is another lady that she wanted more cleavage, and she didn't want any scars in the fold, in the areola. She's petite, she's almost 5 feet.
Wow.
And the implant is the largest that she could take, because anything larger than that would be too big for her. This is to show the scar. The scar in the axilla is minimal. As you can see, there's a line, and over time it gets to be the color of the skin.
Well, thanks for sharing those photos and for being so transparent with us, Dr. Luciano.
I appreciate it. Thank you.
Thank you. For more information, you can head to skinsationalri.com.